The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
All right, Mr. Williams, we're all set.
Yes, sir. We're good to go.
All right, thank you very much. All right, good evening, everyone. This is the Westminster City Council study session of September the 21st. At this time, I'll ask the city clerk to take the roll, please.
Mayor Atchison.
Here.
Councilor Demott.
Present.
Mayor Pro Tem Sites.
Present.
Councilor Seymour.
Here.
Councilor Scully.
Here.
Councilor Smith.
Present.
And Councilor Bowles.
Here.
All right, Council, I want to provide just one short update. Earlier this morning on the call with the chamber, I had reported that the numbers for Adams County as far as COVID had some mixed results. Our infection rates were going back up. What I failed to mention was that our hospitalization rate was going back up again on an average of 3 a day in Adams County. The positivity rate had taken a 0.2 turn down, and the percentage of people being found to be wearing masks had taken a 3% jump back up to the positive side. Unfortunately, late this afternoon, I talked to Jefferson County Health, and all of the numbers in Jefferson County are on the rise, as a trend has now started to show that the infection rates, the positivity rates, and hospitalizations are all skewing upward, and that's now becoming a trend out of the Jefferson County Health Department. The other thing that I learned late last week is, unfortunately, Dr. Mark Johnson has tendered his retirement notice for Jefferson County Public Health. I don't have the date that he's planning to go, but I think they're already starting to figure out how they're going to manage that position. I'm sure he has given them plenty of notice. Other than that, I'll now return to the city council, see if anyone has any updates for committees that they've had this past week. Ms. Smith?
Councilor Smith, thank you. I attended the first meeting in a while for the North Metro Arts Alliance. The last meeting that they had was, I believe, February or March, but because of COVID, we haven't met since then, and they haven't identified programming that we could accomplish adhering to COVID regulations. So they creatively came up with using some of their funds to do a members only event on Saturday, I believe it's the 26th, so this upcoming Saturday. And if you would like more information, please let me know. It is members only, but I think that they're doing good work, and also looking at possibly using funds for, now that school is back in session, to use some of the funds towards using like a creative art class that students could utilize, or giving art supplies to students who need them, because we have a teacher on our board, and she said that a lot of the students are missing out on that arts piece, which is unfortunate. So the board is getting together in October to talk about how we can collaborate in getting that arts piece back in our schools. So that's really great. And then just, I don't have a board on it, but just want to congratulate RTD for opening up their line, the N line today. It is free rides throughout the week, just on N line, and then structured fare after that. So that's all I have for reports. Thank you so much.
Mayor Pro Tem Sites.
Thank you, Mr. Mayor. I had two meetings that I'll just report very briefly on. I served in the alternate capacity at Dr. last week, and we had a really great presentation by JJ Ament of the Metro Denver Economic Development Corporation. And I know it's going to be hard to believe this, and it doesn't diminish anybody's pain, but Colorado is doing much better than the rest of the nation in regards to our economic stability and our unemployment rate due to COVID. So it was pretty positive news. I mean, measured positive. And it also looks like we are probably well situated to bounce back faster than the rest of the nation. That said, housing prices do tend to be an issue, and there is concern about when does that price get so high that we're not as attractive as other areas. Additionally, they mentioned there was a question by one of the directors about the ongoing rulemaking at the Air Quality Commission, asking if that's anything that the Metro Denver EDC ever gets involved with. And I was unaware. I'm sure Mayor Atchison knows this, but Metro Denver EDC was very involved when the AQCC was actually started. And Mr. Ament mentioned that we lose our value proposition in Colorado when we lose why people love being here, which is our natural beauty, our skiing, our environment. So it was interesting to hear the economic case for sustainability and environmentalism. One issue to note, there was a recommendation and a vote of projects to be funded through the Regional Transportation Operations and Technology set aside for the 2020-2023 TIP. And Westminster received recommendation, and then later was voted on funding for two different projects, which came to over $700,000. For those in transportation, I might be misusing this term, but I believe both of these were kind of smart technologies to assist with mobility. So I know that was something that our residents said in our recent citizen surveys they really wanted, and it was great to see that we put together such a strong application. We were one of the highest scoring cities, and so that will be moving ahead. It is not one of the delayed projects. So I wanted to pass that on. And then finally on Friday, I had the North Area Transit Alliance's strategic planning meeting, and we really just went over the agenda for our meeting this Thursday. I have alerted Councilor Voles, and he is going to fill in for me as I have a work commitment with my private sector employer that day. So he's going to be filling in for me, and I have forwarded him the agenda. So thank you all.
Other comments from council? Miss Opie, would you be kind enough to bring us a city manager's report, please?
Thank you, Mr. Mayor. Actually, I have no other items to report tonight. If we'd like to just jump into the agenda, we can talk about the COVID update if you'd like.
Go right ahead.
Okay. So tonight we have a brief overview. We'll be covering our case data, our financial sustainability, and long-term recovery. I'm just going to go ahead and introduce the individuals who are speaking, so we just keep the flow moving. Sarah Borgers will be providing the case data for us this evening from Public Works and Utilities. Larry Dorr, Deputy City Manager, Chief Financial Officer, will give us the financial sustainability update, and then John Hall, Economic Development Director, will join us for the long-term recovery. So with that, I'm going to turn it over to Sarah. Thank you so much.
Great. Thank you, Deputy City Manager Opie. Mayor and Council, as Ms. Opie said, my name is Sarah Borgers, and I am a manager in Public Works and Utilities, and I'm currently sitting in for Director Kirschbaum for this update. So if you could switch to the next slide, Mr. Williams. So tonight I'm going to be sharing the same slides that you've seen in previous weeks that show the number of reported cases and the percent positive rates for the state, Adams, and Jefferson counties, and also some specifics for Westminster where available. Next week, we're going to be changing this presentation to focus on the state's new COVID-19 dial, which was just published last week. That looks to be a really helpful tool, and we're hoping to put it to use. But just starting for this week, we're going to continue with the same graphs we've seen previously. So this is certainly a graph we are all familiar with. It is the statewide 3-day average of daily reported cases for the state. You can see that on a statewide level, there has unfortunately been a fairly substantial increase in the number of total cases over the last couple of weeks. Keeping in mind that this is data for the entire state, the same information at the county levels also shows this increase, but it doesn't look quite as dramatic as it does at the state level. If we can get the next slide. So this graph shows the statewide positivity rate along with the number of tests performed. And as you can see from the red line, which is the percent positive, this positivity rate has remained relatively flat. It's consistently hovering between that 2.5% to 3.5% range. Next slide, please. So this is the 3-day running average of reported cases in Jefferson County. You can see from the dark green line, there has been a slight uptick recently as compared to a low we saw in early September, but it doesn't appear to be quite as large as what we see in the statewide data on that first slide. Next slide, please. So this is the percent positive for testing in Jefferson County. The blue line indicates the 3-day moving percent positive test results, and the bars indicate number of tests completed. Similar to the state, that percent positives remained relatively steady over the last several weeks. Next slide, please. So this is the 3-day rolling average of COVID cases for Adams County. And as we mentioned previously, the Tri-County Health Department website shows this data over the last 28 days, rather than going all the way back to March like most of the other graphs. But you can still pretty clearly see the low from early September and the slow rebound that we're seeing over the course of this month here. Next slide, please. So this is showing percent positive for the city of Westminster within Tri-County Health jurisdiction, so in Adams County. And that red line shows the percent positive as a 14-day rolling average, and the teal bars indicate that days percent positive. So it's a little different than the other graphs. But it is showing the similar trend of having a consistent percent positive rate over the last few weeks. So for tonight, that's all the data I have to share. If we could jump to the last slide, I'll just mention briefly the state's new COVID-19 dial. So as you're probably aware, the state's been looking for a clearer, more transparent way to classify and communicate levels of concern and restrictions for individual counties. And the state's worked with communities and others to develop this COVID-19 dial. Interestingly, it's the same color palette as the fire risk warning system. It's colors folks are used to seeing, and so they kept those colors. You can see the safer at home is split into 3 levels. And each county is placed in these levels or in the protect our neighbors or stay at home based on 3 metrics. We've put a number of informative pages into this week's COVID staff report. So if you're looking for more detail, you can find that there. And next week's presentation will be adjusted to focus more on this dial and the associated stages for Adams and Jefferson County. So that's all I have for this portion of the presentation. I can either answer questions or turn it over to Deputy City Manager Dorr for the financial sustainability update.
Any of the council have questions? Ms. Borgers, I'm seeing no questions right now. Go ahead.
Thank you,
Mr.
Mayor and
Dorr?
members. Thank you, Mayor. Members of City Council, Larry Dorr, Deputy City Manager and Chief Financial Officer, provide a little bit of an update on financial sustainability related to our COVID-19 update here. A few things. I'll provide some spending statistics and a couple progress notes here in just a moment, but first I'd like to ask the City Attorney Dave Frankel to join us here if he would, to make a few comments. You know, our City Attorney has a keen eye to legal developments related to financial activities, and I want to compliment you for that, sir. Related to it, our United States Treasury has been providing frequent guidance on the administration of the Coronavirus Aid, Relief, and Economic Security Act, which was set forth back in March. And that guidance has intended to allow state and local government and the private sector some interpretation of the CARES Act, which is some 800 pages in length. And as that guidance comes out, our City Attorney's Office and our Office of Policy and Budget have continued to review that guidance and measure its applicability to the Westminster distribution of CARES funds. And the latest couple of pronouncements have been very interesting relative to opportunities that might present themselves for our community. We've very diligently and cautiously reviewed those, and now it's time for our City Attorney to share his legal evaluation of these guidance notes, and I will present immediately following the financial opportunity for our community, which we think could be quite significant. So, Mr. Frankel, I have your PowerPoint slide here. If Mr. Williams would kindly bring that up. I've got the 2 bullet points with the quotes from the Treasury guidance itself. I know that this is a little bit wordy here, but I really wanted to have this available for your reference, and if you care to describe that. Mr. Frankel?
Thank you, Mr. Dorr. Dave Frankel, City Attorney. I wanted to sort of add to what Mr. Dorr has put forward, and that is that the CARES Act's funding can be used for certain eligible uses, and the Treasury guidance really has been relied upon by local governments across the country in ascertaining whether a proposed use fits within the allowable uses of the CARES Act. So for tonight's discussion, I wanted to point out these 2 segments of the Treasury guidance. And back as early as April, the Treasury had identified that CARES Act funds could be used to offset payroll expenses for public safety, public health, healthcare, human services, and similar employees whose services are substantially dedicated to mitigating or responding to the COVID-19 public health emergency. So that obviously got a lot of people thinking about what best options were there in terms of utilizing CARES Act funds for that purpose of public safety, and whether their payroll expenses could be eligible uses for CARES Act dollars. That curiosity was, I think, amplified on June 24th when the Treasury gave us the following paragraph, which put forward that as a matter of administrative convenience, in light of the emergency nature of the CARES Act, local governments may presume that payroll costs for public health and public safety employees are payments for services substantially dedicated to mitigating or responding to the COVID-19 public health emergency. So this tied together for the first time the concepts which had been earlier articulated, which was that payroll costs might be eligible, and whether those were eligible or not would depend upon whether the services were substantially dedicated, but also generally opening up opportunities for local governments. Now, many local governments then started analyzing how to pursue this option, and we are now the beneficiaries, I'd say, of those early inquiries, which resulted in a third installment of guidance from the U.S. Treasury, which came out on September 2nd. And as a result of the September 2nd guidance, we now have clear direction from the Treasury that should we wish to pursue CARES Act reimbursement for public safety employees, payroll, I think that both payroll and benefit expenses, including COVID-19 hazard pay and overtime, could be pursued for CARES Act reimbursement. Those would cover the months between March 1st of this year and December 30th of this year. And the qualifier to all of that would be whether or not the employees are substantially dedicated to mitigating and responding to COVID-19. Several questions were raised, I think, as to, well, if you had eligible employees who were substantially dedicated, did that mean they had to be 100% dedicated? Or would there be an opportunity to prorate the amount of time they spent on COVID-19 response? And the guidance cleared this up by saying yes. In fact, you could prorate the portion of those employees' time which was dedicated to COVID-19 response. So I wanted council to be aware of that as an option for our city if we were choosing to pursue it, because I think now we have some clarity thanks to all the other local governments who followed up with Treasury specifically on this issue. So we do have guidance now, which is supportive of this proposed use.
Thank you, Mr. Frankel. I appreciate this analysis, and it's been quite a collaborative effort related to this. We've consulted, as you would gather, with other communities across the country. Our CARES team has talked to others about their interpretation of this and what it all means. Our City Council, you have, of course, set forth appropriations and guiding principles relative to the city's distribution of our CARES funds that we are eligible to receive. We have, of course, received multi-millions to date. We have more funds that we're expecting. We have several plans in place, and you might wonder, what does this mean, and how could this guidance potentially benefit the city of Westminster? And so we began immediately thinking about what has been spent and what hasn't been spent, and should the city consider a transition, and that is allocating CARES funds toward those first responder payroll costs that Mr. Frankel described, which would allow the city to allocate those costs very rapidly. And as you know, there has been quite a discussion about the timing of disbursement of the CARES funds, and there are many lobbying Washington for an extension of the deadline. There's much discussion about how to meet these various deadlines. We've, as a city, agreed in our intergovernmental agreements with Adams County and Jefferson County to provide spending reports and agree to various deadlines that are all quite significant. So we got to thinking about how our fire department personnel are obviously substantially dedicated to COVID-19. Unfortunately, we have had some on-the-job exposures. We've committed significant PPE. We've obviously done lots of training and transported, unfortunately, a lot of those in the community who are suffering from COVID-19. So surely these folks are substantially dedicated, and this latest guidance that the city attorney describes gets us to thinking about how this might change things for City of Westminster. And if I could, Mr. Williams, if you could bring up the next slide, I think I can illustrate somewhat the opportunity. Let me just first describe what's here, because there's a lot of information on the slide. I apologize, this is pretty busy, but let me just kind of run through. The columns, the 4 columns, are the guiding principle sectors that City Council has set forth. So economic recovery, you're about to get a long-term recovery update from our Director of Economic Development, John Hall, here in a minute. And you'll recall this relates to our Westy Rise grants programs and things we've done in that area. Local government recovery. We have brought to you these various opportunities, these adaptations that we're making in our physical space as a city, the plexiglass and all of the telecommuting hardware that we've put in place to keep our workforce in motion. And then people and programs serving people. In fact, Council, you've approved really the disbursement to our partners in housing and in food security to enable those programs. And then last but not least, of course, we have brought to you under the element of social recovery, the opportunity for our community to re-engage in culture and the outdoors and in literacy and et cetera in our various programs there. We have an internal team that's working very hard on this every day to implement these programs. And as you can see, the fifth column, I beg your pardon, is obviously the grand total in each of these categories that's first been allocated. Second, we have brought to you both formally and informally consensus or resolution and ordinance to disperse funds. And in fact, we've spent in these categories in row 3, the grand total $3,191,000. And then you see the final row that we have an unspent amount. And this is where we got to thinking about how we might make some sort of shift or change. And let me first say what the city has first set our workforce working on very carefully, and the opportunity to aid, relieve, and create economic security in Westminster wouldn't change. These are your guiding principles. It's sort of the fundamentals of the federal funds. We want to see those things do what they're intended to do: aid, relief, and economic security. However, if we utilized our first responder pay and benefits, as described by our city attorney, to allocate or collect all of those CARES funds and then demonstrate that they were spent, and we already have appropriations for those items, we would be able to carry forth with all of these particular programs without the spending date deadlines that are currently imposed by CARES. That's number one. The other thing that I think is just as meaningful an opportunity for one, we would be able to very much secure all of these $8.9 million, $8,978,000 in funds. But in addition, we have some great proposals to bring forth above and beyond the $8.9 million to do just what CARES is designed to do. We know that another Jefferson County city has spent all of its CARES funds under similar auspices that we're proposing or suggesting anyway, and have applied for funds beyond the $8.9 million. So that, of course, creates what we believe is an opportunity for Westminster to receive funds beyond the $8.9 million. No guarantees that would absolutely happen. We would need to be convincing of our county partners, but at least if we take down all of the funds and demonstrate that they've been spent under the guidelines required under CARES, we would at least give our community the opportunity to collect additional funds. And in fact, just after my presentation here, you'll hear in long-term recovery about, I'll just give you a little sneak peek about the Westy Rise Small Business Grant Program number 3, and that'll be described to you here in a moment. So again, we felt that as a matter of due diligence, this should be set forth and presented to council, and both the legal analysis, which you've heard, and then the financial opportunity for the community, which hopefully I've conveyed to you there. I would imagine that there are probably a number of questions regarding this, both in the legal or financial realm. We're prepared to answer those for you. There would still be a step required for council. Council would need to find—
Mr. Dorr,
I beg your pardon, Mayor?
Go ahead.
Oh, I was just saying a next step is that City Council would need to formally find via resolution that the city's firefighters were indeed substantially dedicated to fighting the coronavirus pandemic in a formal finding. That would be a next step for council. But I beg your pardon, Mayor, please, I'd be happy to answer any questions. I know that's a lot to describe here during your update, and I'd be happy to answer any questions along with City Attorney Frankel. Thank you.
A couple of questions, then I'll turn to the council. You have 5.7 million that you haven't spent. And we have a deadline that's still mandated so far that we have till December 31st to get those funds spent, not allocated. Is that still correct?
Yes, sir.
All right. The other part of that, if we're going to undertake, I'll use the fire department as an example, since that's one you've been using. If I have a shift of firefighters on and they make calls for whatever reason, and there is some element that may be identified that's COVID related, how do you split out a normal call cost to some portion of that being allocated to COVID response? How far back do you think you're going to try to go do that? And then can you prove that so that it meets the CARES deadline of December the 31st?
Thank you. I'd like to invite Dave Frankel to come back on. His legal analysis and advice has been that we may not have to go to that length of detail in tracking an organization, Mayor, but I'd really like Mr. Frankel to bring that to light, sir.
Thank you, Mr. Doerr. And yes, Mr. Mayor, we are under the current time constraint of spending the funds. And I believe December 30th is actually called out in the legislation. And any extension of that deadline, I believe, would have to be an act of Congress, so it's not certain would happen. So for planning purposes, we are looking to expend the funds between now and December 30th. The prorating of our first responders and public safety employees, we believe would be defensible in that we would not be proposing 100% of their time, but we understand that other cities have found a lower percentage of the total, which they are able to support. And I believe that we locally would be able to survive an audit to support a funding level. And I think that with the way these numbers work out, we would, if wanting to allocate the unspent portion of the lower right-hand corner of this chart, we would need to be ready to substantiate on the order of 15% of our total for our first responders and public safety employees, which I believe absolutely is within the realm of doing and would be very defensible as far as a potential audit by the Treasury Department.
Okay. Councilor DeMott.
Thank you, Mayor. I'm just curious, and I believe this question will be for Mr. Doerr. So how does this impact what we saw this last Saturday, and how was this, or was this even contemplated in what you shared with us this weekend? Does this maybe give us a little bit of room if we are able to do what you're proposing here?
Thank you, Councilor DeMott. Thank you for the question. And clearly this legal advice and financial analysis has gone on for a number of days. So at the end of the day, I think the short answer is no. This doesn't change anything going into the city's budget challenges because we have appropriations for first responder personnel. That wouldn't change. We have appropriations for these various CARES Act endeavors. That would not change. What would change is what we're reporting, submitting, and claiming necessarily under our intergovernmental agreements and so forth. So that was the longer answer. The shorter answer is no, it doesn't change anything because we would still proceed with the spirit and the letter of the CARES Act as it was, and unfortunately it doesn't offer any opportunity for us to avoid any of our changes in spending habits, or not spend our spending behaviors as a city, and our need to provide services. So much as that felt with CARES last month, 2 months ago, and when it first came forward, it wouldn't be, you know, backfilling revenues or providing a backstop for a loss in sales tax revenues or other economic activities. So, but thank you for the question. That's one of the first things when we read the guidance was the hope that maybe that could be there, but we will be carrying forward with council's appropriations for first responders and council's appropriations, what you see before you here.
Okay, I guess that doesn't really match up to me. So like, I mean, I understand that the effort is to try to not leave money at the table is what I'm hearing. But if you're trying to backfill first responder pay that would otherwise come from the general fund, how does that not help us cover the gap? And what's the benefit then if it doesn't help us cover the gap?
The big two things that I talked about just a moment ago. One is we ameliorate the deadline at that point. That's really the big key. We no longer we will have submitted all of our reimbursement requests. We would have submitted all of our documentation, as city attorney described, and we would be relieved of this $5,786,000 in spending to be done by December 30th. And number one, and number two, we know that other governments are going to struggle potentially with this deadline, and it would give the city the opportunity to submit additional requests for CARES spending for certain specific programs, none of which have been identified at this point, because we still have unallocated funds, as you see here.
So
we
have the here real quick so I understand then. So what you're suggesting though is that we kind of earmark the funds off of expenses that we can allocate it towards, but not actually allocate the money so that we could use it for other things. I'm still not following what you're suggesting.
What I'm proposing is that what you see on the screen under economic recovery, local government recovery, people and programs, and social would carry forward as is, which of course still adds up to the $8,978,000. But our submittal for reimbursement to our counties would take a different character. We would be able to set forth legally that our ordinary first responder pay was eligible for that, and that just relieves our deadline for that spending and demonstrates that we've spent our CARES funds and gives us the opportunity to take down additional money should we have programs that can assist the Westminster community, and obviously receive approval from our two partners at the counties who control supplemental disbursements.
Okay, thank you.
Mayor Pro Tem Sites.
I was going to ask city manager or deputy city manager Dorr to just I was going to make sure I understood it correctly, and he just reiterated what I was going to ask him to, so I'm fine.
Other questions from council at this time? Otherwise, we'll move on to the next portion.
Mr. Mayor, if I might ask, I just want to be sure that it is the pleasure of council to carry forward in this direction, and if so, then I will bring forward a resolution with City Attorney Frankel for your formal findings that our first responders are substantially dedicated to COVID-19, fighting COVID-19, and that we will carry forward with this interpretation of the Treasury guidance as is, Mayor.
Okay, let me just ask if there's any member of council, and just let me know verbally if you want, that has an objection to us trying to get this additional funds, then please say so.
This is Council.
Go ahead, Mr. Mott.
Well, Anita, go ahead. I'm sorry, Mayor Pro Tem Sites, go ahead, and then I'll speak.
Okay. I just want to make sure that obviously we're not overstating any of the first responder impacts of our first response budget impacts of COVID or time allocation of COVID. We don't ever want to overstate anything and be accurate. as much as possible. But I do understand wanting to still honor the commitments we gave to each of these buckets, particularly as I believe there are IGAs attached to some of the buckets, even if the money hasn't been spent. So this seems appropriate, but obviously just wanting to make sure we're accurate and do not overstate. But other than that little caveat, I'm very comfortable with this, and I think it is a very smart way to ensure that we get our full allocation for our residents.
Counselor Demott.
Yeah, I'm still trying to match this up in my head, I guess, because if it's not really backfilling the money and we're just using that point so that we can be eligible for more money, I'm not sure I'm comfortable with it. So, and maybe I don't understand exactly, how that works, but it just doesn't, I don't understand the spirit of it. If we're saying that we are going to, basically we have certain employment costs for first responders when they were responding to COVID, which is true, they did do that. But if that's not truly going to reimburse those monies, I guess I'm not really following, what the benefit is besides being able to go and get more money. So where does that money go if it's not truly backfilling the cost that we're stating it backfilled?
Yeah, I think, Councilor Demott, I had the same kind of concern as how are we allocating this, and I think I finally got it. It only makes us eligible for new programs that we haven't already committed to if we can find a way to find those funds. But as of right now, those other programs haven't even been identified. And we would have to have the approval of either one or both of our partners, depending upon where that money is coming from. Through the current IGAs, we don't have that approval, which could require an additional IGA modification. But at least that's the way it took me a while to get my head there as well, as to how is that affecting that bottom right-hand corner number? And it just makes it that number is fully allocated at the 5.7, but if we can make that number smaller of what we have already committed, then that allows us to go after new money, but still have to get rid of the 5.7 by the end of December.
Okay. Well, thank you for that, Mayor. I guess I was along the same lines of kind of what Mayor Pro Tem Seitz just stated. I just want to make sure that we're being transparent and we're also being within the spirit of what the CARES Act is allowing. So if everybody else is comfortable that we're doing that, and I think you kind of helped me a little bit, it's still a little bit fuzzy. I mean, I know there's a lot of moving parts to this and a lot of partners, and it seems like this money, had to make a lot of jumps before it got to the municipality. So I get that it's complex, but I guess my desire is to make sure that we're doing those things. And if that's the case and everybody's comfortable, then, I'm comfortable with it.
Councilor Scully.
Yeah, so thank you. I think I understand where Councilor Demott is coming from, though, is it sounds like this doesn't change our bottom line that we discussed on Saturday. And I think that's what we're asking is this is meant to offset our expenses in our normal budget so that we can allow some of our regular funds to go toward filling in the gaps of our shortfall, is my understanding. So but it doesn't sound like this is going to help us do that. And that's my concern too. I think this is fantastic. If we can find a way to use it, I think we should. I also share concerns with Mayor Pro Tem Seitz that I don't want to see us use it necessarily just to use it and maybe not be completely transparent and forthright in how we are using it. That maybe we're creating a situation rather than being honestly having a situation. I don't mean to imply anything, but I think that's where the concern is. And I certainly don't speak for my fellow counselors, but that's what I'm hearing as the discrepancy and the concern, and I share that concern. So I guess that's where I certainly will move this forward. I believe in this. I think that we need to work on it, but I'd like to understand how it's going to help our bottom line and allow us to free up funds in our current budget that we can now apply to our shortfall.
Mr. Doyle, you want to respond?
Yeah, thank you, Mayor. Thank you for that opportunity. Yes, I do understand the concept of improving our bottom line. I might say this, what I think in the financial analysis is this protects our bottom line as it has been, meaning these funds that you see here, and I think the mayor touched on this and brought it to light, is the $5,786,000, we're still vulnerable to these deadlines and being able to procure services and being able to procure products and materials and so forth. And we are vulnerable to those deadlines. I'll tell you, we're working tirelessly to get these distributed, but as described, we have intergovernmental agreements with other parties like Growing Home and others that we're attempting to partner with. And in fact, even our grant program, while we've had a great subscription and folks interested in these grants, we have to execute on agreements with those parties, disperse funds, and track all of the documentation. So this change doesn't change any of the buckets and the spirit of what council has appropriated. But what it changes is our reporting requirements and our ability to protect this $5,786,000. So in terms of impact to the bottom line, I think it sets forth a guarantee. I'll go so far as to say that all $5,786,000 will be captured by Westminster residents and businesses, whereas there is some possibility today, even in the face of our very hard work, that some of these funds may not get dispersed to the community. And so it's really about protecting our bottom line and not being able to backfill or ameliorate really the loss in revenues. And I might invite City Attorney Frankel, if you have any additional comments about the various audits. I know you mentioned that, and we're cautious, we're conservative. We did some very thorough analysis of this before bringing it to you, and we want to ensure that we're doing something that is conservative. The city will pass its various audits and its commitments to its other partners. So I think that's probably a key fundamental.
Thank you, Mr. Doerr. Yeah, so my understanding is that other local governments have proposed levels of funding that are in excess of what we are considering locally. So the Treasury Department has, my understanding, approved higher levels than the 15% we would propose locally. So I think what we would just be wanting to be comfortable with is that we can substantiate 15% of our payroll expenses as having been dedicated to COVID response. And in that way, we are able to use the CARES funding towards our first responder and public safety payroll. By doing that, we do have more flexibility on the timing of expenditures. And it's my understanding that each of the 4 uses of funds that are depicted on the chart would be fully funded. In that sense, correct me if I'm wrong, Mr. Doerr, it's not necessarily a change to the city's bottom line, but it's a protection of each of these 4 buckets to ensure that we can spend the bottom number in each of these buckets without risk of losing the funding on December 31st.
Thank you, Mr. Frankel. Yes, I think that describes our approach to the bottom line, which is preserving these allocations, and might improve our bottom line if we're able to accomplish everything we're describing, and then capture additional funds from the counties, which we've gotten indications that there's an interest in doing that, and we would work hard to bring additional funds to Westminster.
Mr. Doerr, I think that is exactly the statement I was looking for, was that I wanted to hear you say, and I know you can't say it in a factual manner yet, but I wanted to hear you say this might improve our bottom line. That's what I was looking for. So thank you very much.
Councilor Smith.
Thank you, Mr. Mayor. And I apologize to staff and to my colleagues. It's been a long day at work, so I'm just not entirely following what we're asking for here and what staff is looking for from council. So just to reiterate, and I'm sure you've answered this, it's just not osmosising into me. So we're not this allows us to secure 5.7 million, as what you said, of what we have. And this could potentially allow us to look for more CARES funds if it's available, correct?
Correct.
Okay. And so with that, do these, because I know that the CARES dollars came in separately from Jefferson County and Adams County. Is this, one was a September deadline, I believe, and one was a December. So is this December or is this September? Or is it combined, if that makes sense?
Thank you. Yeah, thank you. Let me get, I was just trying to think about the dates, and they're different, of course, for each county. Naturally, it couldn't be just that simple, could it? Let's see, for Jefferson County, there was first to be a spending plan filed by September 1st. And we have done that. I described that on August 24th, that we would be filing it under the 4 categories and guiding principles set forth by our council. And we met that deadline and filed the details of that. Incidentally, other local governments were struggling to do that for Jefferson County, and they extended that deadline to November 1st. That's a real key indication. So we met that deadline, they had to extend it. And Jefferson County requires funds to be spent, I believe it's by December 30th. In Adams County, the deadline is December 4th, so a little bit earlier, as in the intergovernmental agreements approved by City Council. So 2 separate sets of deadlines. Our opportunity as a city is to describe this first responder substantial dedication and file reports with details that would, by the way, we haven't collected the full $8.9 million. If you recall, each county was sending it in buckets, may I say that, or in batches as the city spent down funds that we were replenished. Well, we would submit these invoices and be able to take in all of the funds and meet all of those deadlines by quite a good while. And it would allow our staff to develop additional spending opportunities under CARES to submit to the counties and potentially have additional funds. So yes, you described it well, related to the 5.8, or 5,786,000. It gives us the opportunity to ensure that those funds come to Westminster for the exact appropriations that have been described here. And it should be noted that as we step through this, we still have some additional programs to bring forward. We've brought forward several, as you know, our Human Services Board. It seems like nearly every meeting we have one of these updates, but that's the purpose of it, is to do this in a timely way. And we have another one here for you just to follow me here. So I think you've described it well, Councilor Smith.
Okay, thank you. And this 15% of payroll expenses, that comes out of the 5.7, or is that something that we're looking for additional funds out of CARES?
Mr. Frankel, let me take a try at this if I may, but I think that the 5.7 million would equate to that percentage of our first responder expenses during the time period under which they were eligible, which substantiates the idea that obviously there were other activities undertaken by those first responders not related to COVID, but many of their activities during that period of time were related to COVID and are quite reasonable and within the range of percentage allocations that we've seen from other cities, both here in the Front Range and across the United States.
Okay, great, thank you. So really the ask is looking for this 15% for our, not only to secure the 5.7 million, but the ask is the 15% of payroll expenses go to our first responders. Is that what I'm hearing?
Yes, Mr. Frankel, would you describe more specifically the exact finding that council would have to arrive at in its resolution?
Sure. So the 15%, just to make it really clear though, in order to get reimbursement for 5.786 million, that equates to 15% of our payroll between March and December, which is the eligible window for reimbursement. So just so that that's clear. But the The findings that we would propose by way of a resolution for council consideration would be to recognize the nature of the assignments that our public safety and first responders have taken during COVID, and to establish our view that that they have dedicated a substantial amount of their time to responding to COVID. And it's our intent to provide this adequate level of documentation so that we can move forward in securing the $5.786 million to fund all of those 4 buckets that are depicted on the chart.
Okay, thank you. I think it's finally kind of seeping in and I'm starting to really grasp it. I just wanted to be clear on what I was helping to move forward or what I would be not voting on. But I agree with your findings, and it seems like it's within the CARES, I guess, parameters for us to use. And so I would be approving that, because I did get to see firsthand a couple months ago, meeting with Station 4 and hearing their stories about their COVID responses and some of the challenges that they've had to face. So I think that this is important for us to make sure that we're dedicated to that and understanding that in its totality. So thank you so much for bearing with me. I know that you probably feel like you've repeated yourself several times, but it's finally kind of setting in. So thank you.
Mayor Pro Tem Slide.
So I'm going to ask the question I maybe should have done just when I originally had posted it. But it sounds, I feel like it might be beneficial to the conversation. It sounds like there's murkiness in this, and I just want to boil down my understanding and have you correct me if I am incorrect, or let me know if I've got it right. So everything in these 4 buckets are eligible expenses or programs to utilize CARES dollars. We have also, and we've known since April, but we're waiting for more guidance, understand that reimbursement for first responders impacts to COVID-19, including payroll, could be included. We have given spending plans to both counties that are allocating these dollars out, letting them know about these 4 buckets. We've entered into IGAs. We've approved appropriations for these funds. But what we're fearful of is, even with all of our good efforts and how hard we're working on this, we will not be able to spend down the approved amounts before the deadline. And so that $5,786,000, those are all eligible expenses as they are there, but there was also the eligible expenses of our first responders, and being very conservative, only doing 15%, which is really less than we've seen other agencies do. We get to double that amount, right? So the full, while we don't have that much money allocated, the full impacts to Westminster and our attempts to respond to it, is over 10 million. It's double this. And so while we will still be using it for the intended purposes that we've put in our spending plans, that we've entered into IGAs, that we've done appropriations on, we're just communicating that these dollars, that it was also eligible. It allows us to spend it down quickly and gives us the time and flexibility to still honor the programs that we've entered through our spending plan and also through our IGAs and our appropriations. And that we've communicated to our residents at every single one of these and on Monday nights when we voted on it. Is that correct? Is that the goal, or have I misstated anything? And then the gravy, which I think some of us, including myself, are clinging on to, was the ability then, after doing that, to potentially apply for more, because there might be other local communities that weren't able to spend down, and so there might be more dollars up for grab. Is that a correct encapsulation of this, or am I still off?
That was very well said. I think you've described it very well. And Mr. Frankel, I hope you agree.
I do, and I hate to prolong, but I just understand the concept of the $10 million here, because I don't want to overpromise here.
No,
Because
I am
by-
not saying, yeah,
But
I
by
was not,
allocating the 15%, we would be defensively taking down the 5.786, and that would guarantee the 5.786 to our residents.
correct. I am not in any way, shape, or form saying that we would be applying for another 5.786 or expecting to get another 5.786. I'm just saying there was, in the amount of money that we as a city have spent on COVID, there is another 5,786 in that 15%, found within that 15%. So I know we're not actually backfilling it, but that was also eligible. So that's what we're going to be submitting in order to get the approval to spend down, but these will be the buckets that we're honoring. That's why there's no backfill. Is that correct?
Yes.
Okay. Sorry, clear as mud the way I explain things. I apologize.
Other comments from council? All right, to make this a little simpler, I'll just go through each of the council members and give us a yes or no if you're okay in supporting the resolution or the proposal that Mr. Dorr is going to bring forward in a formal adoption. Mayor Pro Tem Sykes?
Yes.
You need, okay, yeah. Councilor Scully?
Yes.
Councilor Demott?
Yes.
Councilor Voles?
Yes.
Councilor Seymour?
Yes.
Councilor Smith?
Yes.
And the mayor. Bring it forward, Mr. Dorr.
Thank you, Mayor and Council. And my pleasure to introduce John Hall, Director of Economic Development, and wants to describe potential opportunities under long-term recovery. And I think Mr. Williams that Mr. Hall may have a different slide that he'll cue when he is ready. Thank you, Mr. Hall, and thank you, Mayor and City Council members.
Welcome, Mr. Hall.
Thank you, Mayor and Council. Good to be here this evening. I do want to seek your consensus on a new business assistance program. Before I get to that program, I want to provide a couple of other updates. One item that Council has asked about a few times relates to our expanded outdoor dining program. You'll remember that using his emergency authority, City Manager Tripp created an expanded outdoor dining program, and that's been very successful and has been used by many restaurants over the summer. You all have correctly pointed out that as we enter winter, there may be modifications that are necessary to some of those facilities to accommodate outdoor dining. The first thing that I want to point out is that our original program was set to expire September 1st, and it has now been expanded or extended to November 30th. Each business participating in the program has been informed of the extension. At the same time, we've modified the program to include additional information on the use of tents and covers and associated heating and lighting provisions. And those businesses with approved plans, those that entered under the original program, will be asked to submit a modification if they intend to add tents and covers. And the guidelines have been updated, and those will soon be posted on our business resource page on the city's COVID website. So I just wanted to provide an update for you on that we are working hard to continue to accommodate restaurant expansions into the fall and early winter. And we'll come back to you as those conditions continue to change. Next slide, please. Thank you. So staff would like to seek your consensus on a third business assistance program this evening. We have the catchy name of the Westy Rise Business Grant number 3. I'm sure we will come up with something better for marketing purposes. But just as a brief recap, you'll recall that our initial business grant program, which it was completed earlier this year, assisted a total of 321 businesses, primarily with rent. And the total expenditure was $1.345 million. And we are very pleased with the response we got to that program. And so we want to continue. However, that was a program that was only designed to bridge for about 60 to 90 days. The second program that we launched and have completed was the Westy Rise and Dine program, focused on our restaurant community. You allocated approximately $500,000 to that program. We've expended $465,000 and assisted 60 restaurants with those funds. So we're very pleased about both of those programs. This third program would be the most flexible and provide the most per business assistance of any of the programs we have proposed. And it would seek to address three things. First, it would seek to assist businesses with satisfaction of rent and mortgage obligations. The total amount for this use would be $15,000 for 3 months of rental and mortgage payments. The second use of funds under this program would be to help offset operating costs due to the purchase of PPE or personal protective equipment. And the maximum grant amount under that portion of the program would be $2,000 and would be based on the number of employees in the business and, of course, therefore the amount of PPE required. The third use of funds proposed for this program would be to allow bars and restaurants to purchase equipment related to outdoor seating and heating through social distancing this fall and winter. And we are proposing a maximum grant amount in that category of $1,000. In total, a business could be assisted in a total amount of $18,000. We're proposing $500,000 go to this program, and just to reiterate, the source of these funds would be CARES Act monies. Next slide, please. To be eligible, businesses would have to have seen a reduction in revenue due to COVID-19, not a very difficult hurdle in this environment. They'd have to be in operations at least 6 months prior to the application date. They'd have a physical address here in the city. We've increased the number of FTEs, so no more than 75 FTEs, but that gives us a broader reach among the business community. Businesses with more than one physical location could apply for multiple locations, but the maximum award amount would still remain at $18,000 in total. The business would need to be operating and actively conducting business as of the application date, unless they were required to be closed because of a public health order. They'd have to have an active Westminster business license. They would need to be in good standing with the city and the Colorado Secretary of State's office before grant funds could be awarded. So a little bit different than our first program where we had extensive discussions about the good standing clause. This would simply say that before we disperse money, you need to be in good standing. So they would have the opportunity to go get in good standing and receive funds. Businesses that have previously accessed our assistance programs, the Westy Rise Business Grant Program or the Westy Rise and Dine Program, would be eligible. So this would allow businesses that have benefited before to continue to benefit. Corporately owned national chains would not be eligible, and home-based businesses would not be eligible. So that's an outline of the program. I'd be happy to answer any questions, but tonight we are seeking your consensus to launch this program as quickly as possible. Thank you.
Councilor Scully.
Yes, thank you, Mr. Mayor. Mr. Hall, this is wonderful. I'm so excited to see this. I know there were many businesses that qualified for our first business grant, and it was so welcomed. I do have a question. It says corporately owned national chains are not eligible. What if it's a corporate chain, but it's not owned by the chain? It just has the title of the corporation on it, but it's actually privately owned by a business owner in Westminster.
So, Councilor Scully, franchises owned locally would be eligible, and that's not an uncommon circumstance here in the city. But those that are corporately owned, and we do have some of those, would not be eligible.
Oh, I see. Okay. And so it sounds like roughly 27 businesses will probably benefit from this. Is that about right?
That's correct, assuming that each one received the maximum grant award.
Right. Okay. Well, very good. Thank you so much for answering my questions.
Thank you,
Councilor
Councilor.
Thank you, Mayor, and thank you, Mr. Hall, for this presentation. I appreciate all the work you've done over the course of this to assure our businesses can try to stay competitive. I have actually had quite a few questions around some of the ability to be able to do the outdoor heating as I've visited our different restaurants in the city, and it's starting to get a little chilly on Saturday night. So I know that they're planning for it, and I did have a specific question that's outside of this, and so maybe you can't answer it, but what it really gets at, are we going to also help? I am supportive of this, but are we also going to help them with guidelines with like the fire department and stuff? I have a specific question that I actually keep meaning to try to get an answer for from one of the restaurants because they're looking at like covering and stuff. So what kind of heaters are they typically allowed to use, and is there going to be any adjustment around that due to the situation? And do we already have some guidance that I can point businesses to, or can we do that in conjunction with this if we're going to be giving out grants to, you know, meet that very need so that they understand exactly what they should and shouldn't do, and how are we partnering with the fire department for that?
Councilor DeMott, thank you for the question. Yes, the information I provided at the outset of my presentation this evening regarding the extension of the outdoor dining program and the accommodation for tent covers and heating and lighting came from our chief building official, Dave Horace, who's been working very closely with the fire department to make sure that the regulations that we're putting out there are consistent with life safety codes. And so I would be happy if you want to direct someone to me, or if you'd like to send me an email, I'd be happy to forward that on or connect them to the right individuals at the city to get their questions answered about types of heaters and those kinds of things. So happy to help.
That's great. Again, I think this is great. I know I've been one of which I think all of us have been asking about this, but I know that the restaurants have been asking every time I go in, and the owner knows I'm a council person. They're definitely asking me about this. So I'm glad to see this, and I appreciate all your work on this. I think this will be helpful to them, and hopefully we don't have to use it too much longer, but it'll be good to be able to give them any kind of step up that they can get as we get into the cold season.
Agreed, Councilor. Thank you.
Councilor Volz.
Thank you, and thank you, Mr. Hall, for bringing this forward. I guess my one question, kind of follow up on Councilor Scully. Well, first of all, Councilor DeMott is correct. We do get a lot of questions on this, so thank you for bringing this forward. I think even recently we've all had questions on this. Councilor Scully had mentioned, and I did a quick arithmetic as well, and you had mentioned that we have helped 60 different restaurants, and this will help 27 to 30. Is this, I guess my one simple question would be, is this going to be enough? Do you anticipate if all 30 get to 18,000, then we're maxed out? That's about 30 businesses versus the 60 we've helped before, which would be closer to $1 million for this kind of program, if they get the full amount. So what do you think about that? I guess I just want to hear a little bit more about that. I support it either way, but I'm just kind of curious.
Certainly, Councilor. It's a great question. You have been doing your arithmetic correctly. This isn't as nearly as complicated as the last discussion you had. So what we have found is that we have been reasonably accurate in our estimates thus far. The initial Westy Rise Business Grant Program, we allocated $1.5 million. Applications ended up, they just kind of petered out at about 1.34 million. The Westy Rise and Dine program, we allocated $500,000. We're at $465,000. We haven't seen another application for several weeks. Certainly, if we went through this $500 million and it were, let's say, the middle of October or late October I would seek to come back to you for additional allocations. But this is a healthy starting point, and we feel confident this will give us a good sense for what the demand is out there.
Okay. Yeah, thank you for that answer. I support this wholeheartedly. So thanks for your work on this. Thank you.
Counselor Smith.
Thank you, Mr. Mayor. I know that one of my questions from the last time, I know that we went over this extensively for the good standing. I know that you have a bullet point here that says that to be in good standing before grants are awarded. Can you define how long it could take them? So if it would take a week, could we allow a month? Could we allow till the end of the year? What is the time frame for those to be in good standing for, I guess, issuing these grants?
Councilor Smith, there would be two limiting factors. One would be whether or not we have funds left by the time that they get in good standing. The other one would be, does it still fall within the expenditure deadline of December 31st required under the CARES Act program? So, and then there's the practical side of how quickly we can get things out. Having done several programs now, we're getting pretty quick at turning around applications, identifying where there may be deficiencies, reaching out to those businesses, asking them to remedy those. We've been looking at 10 days to 2 weeks to get checks into people's hands. So I think that's a reasonable time period. Of course, it depends a little bit on what the issue is. If it's a very simple issue that they can handle online, it's not a problem. If it's an inexpensive issue, that's probably going to be easy to remedy. So that's how I'd answer that question.
Okay, thank you. And I appreciate us changing this a little bit. I know the first time we had set before, I believe it was March 1st, to get in good standing. So I think that this allows for those that didn't know or may not have known that they weren't in good standing. So I really do appreciate this, and I'm for moving this forward. So thank you.
Other questions from council? All right, seeing no other questions, I'll again poll the council to make sure that everyone's okay with the recommendation by staff and have them bring it forward as a formal adoption. Mayor Pro Tem Sites.
Yes, I'm delighted by the recommendation. And
Councilor Scully.
Absolutely.
Councilor DeMott.
Godspeed.
Councilor Vols.
Let us support it. Thank you.
Councilor Seymour.
Full support.
Councilor Smith.
I support.
Mayor also. Mr. Hall, go do some good.
Thank you, Mayor. And if I could, by way of clarification, no additional formal action would be required by council on this particular program, because we would be administering the program and not dispensing funds in excess of $50,000 to any individual business. So we would just go ahead and get rolling on this.
All right. Go do good.
Thank you.
Ms. Opie, do you have anything else in regards to the COVID updates?
Yes, sir, we're all done, unless you have any other questions for us.
Hopefully we got all of our questions answered.
Wonderful.
Also, the next item on the agenda is an executive session under your agenda for item number 1. Mr. Frankel, if you come forward and we'll talk about number 1.
Thank you, Mr. Mayor. The first executive session that's proposed for this evening is to consult with the city attorney regarding legal issues associated with council rules and protocols pursuant to Westminster Municipal Code 111.3C3 and 8, as well as Colorado Revised Statute 246402 4B.
At this time, I will confirm with each member of council that they are prepared to go into executive session number 1. Once we adjourn out of here, we will re-adjourn into that meeting. Keep in mind that it is a separate meeting and a separate password. At this time, I'll ask each member to confirm verbally that they are prepared to enter into that session. Councilor Smith.
Yes, sir.
Councilor Seymour.
Yes.
Councilor Vols.
Yes.
Councilor DeMott.
Yes.
Counselor Scully,
Yes.
Mayor Pro Tem Sights,
Yes.
Mayor as well. We are prepared to go into that one. Before you go, while we're still on the public record, we have a second executive session. Mr. Franklin, would you enter in the record what that one is?
Thank you, Mr. Mayor, and I appreciate your queuing it up this way because obviously we do need to vote in an open meeting to go into an executive session. And as we are going to leave this open meeting, in order to conclude it, I think it would be preferable to have the votes in advance to go into the second executive session before we adjourn the open meeting. And so the second executive session that would be proposed is an exec session to discuss a personnel matter, the city attorney's performance evaluation pursuant to Westminster Municipal Code Section 111.3C1 and Colorado Revised Statute 246402-4F.
All right, as defined by the city attorney, we have a second executive session scheduled. At this time, I will also confirm that each member of council is prepared to enter into that session later on, where we will go from one executive session directly to the other. We will not come back into open session. So at this time, I'll ask each member of council to confirm verbally for the record that they will be prepared to go into that session later tonight. Mayor Pro Tem Sights,
Yes.
Councilor Scully,
Yes.
Councilor Demott,
Yes.
Councilor Volz,
Yes.
Councilor Seymour,
Yes.
Councilor Smith,
Yes.
and the mayor also. This time we will adjourn. It is, I'm going to just call it 7:48. We will adjourn from the public meeting. Instead of going directly into the other one, I'm going to give you a short break. Let's try 7:55. It gives you about 7 or 8 minutes to take a quick break and then come in. We will re-adjourn in the next session and under executive session at 7:55. For the public, thank you very much for attending tonight. And this is the end of the public session.